DBXO and Alexandra S&T Dellin. So, I can't read it in my glasses. Oh God, what's happening? What's going on? Anyway, good evening all. I hope you're all in the festive spirit, and I've got some questions to go over. So a little bit busy. Oh my goodness me! Oh, I've already got a question. Do you do neck lifts? I saw that somewhere, and so I better answer that. Better knock that on the head right now. I don't do neck lifts. Terribly sorry. I do not do neck lifts. My special interest is breast, and I sort of mainly breast and body contouring in terms of the cosmetic surgery I do. I don't do facial cosmetic surgery, although I do moles, cysts, lumps and bumps on the face, but I don't do kind of anti-aging facial work. Nose jobs, not an anti-aging thing, but I don't do nose jobs, and facelifts and blepharoplasties and brow lifts and neck lifts. So I don't do neck lifts. That will be a facial plastic surgeon who want for that. And sorry about that. And I got a little one here that suggests I've got a question. Are there any complications with implants that may occur whilst pregnant? No. Sometimes people phone me and say I'm pregnant and they're worried because they've got implants in. And the answer to that is completely do not worry. That's absolutely fine. There's no problem with pregnancy. There's no problem with breastfeeding, assuming you can breastfeed, anyway. Some people can't breastfeed, but implants are not going to affect your ability to breastfeed. Don't worry about it. If you some people worry about the silicone because there might be silicone kind of ingested by the baby, but there's silicone in the teat when they have those bottles, so there's completely no problem. The only thing that I think when people say to me, is there any problem breastfeeding with implants in, I'm always like, well, no, but then I'm thinking, hold on a minute, that means you've become pregnant with implants in, so it can affect the shape of your breasts. So that's the thing. Having children can affect the shape of your breast, and breastfeeding, your breast becomes engorged, and then when you finish breastfeeding, then they can become less engorged, and they can droop, and they can become smaller. So they can change in size and shape, should we just say, by having children. So that's the only thing to consider. But specifically in terms of having children and with implants in and breastfeeding with implants in, no problem at all. Do not worry. DBX, thanks for the Christmas card. You're very welcome. Problem with everyone on Twitter and it's not Twitter, is it? God, that's how uncool is that? Not only have I used the term Twitter, I'm not even on. Well, I am on it, but this isn't the live on that one. But on the gram, I don't know who anyone is. What's that? DBXO. Anyway, I've sent you a Christmas card, but you're very welcome, DBXO. You're very welcome. Happy Christmas. So pregnancy, neck lift. Right, let's get cracking with this one. What I've got here is I've got a question which goes a little bit like this. Do we treat hyperpigmentation? No. So Oh, Davina. It's Davina. Oh, you're very welcome. I'm glad we looked after you, Davina. And yeah, you wrote a review, so thanks for that. And I'm glad you felt that comfortable enough to leave a review. It's really lovely when people do that. So do we treat hyperpigmentation? No, we do not treat hyperpigmentation. Hyperpigmentation is something that will be treated more by a dermatologist. So hyperpigmentation is areas of skin which have got increased pigment, so brown patches basically. I don't treat it, so I don't want to go into it too much because I'm not really a specialist in it, but it's a difficult area. It's a difficult thing to treat, but there are kind of bleaching agents that can be used, quinones and things like that, which can be used to kind of bring down the pigment in an area of skin. And it's kind of more of a topical thing that's treated topically. And as I said before, I think last week, that dermatologists are much better at that sort of side of skin management. We are very good at the surgical side of it, but they're better at the medical treatment, and hyperpigmentation is more of a medical thing. So no to neck lifts, no to hyperpigmentation. Not doing very well here, are we? What we got? Have we got an operation that I do? Oh yes. How would you tell if I had a keloid on my ear or if it was a cyst? Right. Okay. Nice question. Well, the obvious thing is, have you had a piercing? So a keloid is from a scar. So a scar would, if you've had a piercing, then it could be either. If you've not had a piercing, it's more likely to be a cyst. And we would kind of have a look at other areas to see whether there's any obvious keloids in other areas. Keloid is a kind of lumpiness of the scar. So the scar is raised and it's kind of proud of the skin, whereas a cyst will often be underneath the skin and the kind of skin can look normal. So they might look different. They might, I'm thinking this question's being asked because I think there was someone who I wasn't sure which it was. So I was about to say, you know, you should be able to tell the difference by looking, but then you're gonna say, you know, oh well, what about this patient that I said looked like either? But you should be able to tell. A lot of times people send us photos, and I'm very happy to give an opinion on a photo, but it can be difficult to be too sure on a photo. And you know, often it's better to actually see you in real life. But broadly speaking, a keloid is a kind of lump of the skin. It's a skin problem, whereas a cyst is a lump underneath the skin, and the skin's normal, and it doesn't tent up the skin quite as much. The skin will be like quite prominent with a keloid scar, but less prominent with the cyst. And also, when we examine you, we might be able to feel that the skin's normal, but it's kind of like there's something underneath there. So yeah, we would have a go at telling, but and it obviously is quite an important distinction to make because the treatment will be different with a cyst and a keloid, because you try and avoid surgery with keloids, and if you do surgery, you do an intralesional excision of it, whereas with a cyst you would cut the cyst out. This is the amazing plastic surgeon Jonathan Staiano I was telling you about. That's a good comment, isn't it? Is that a family member who's written that? Thank you. Iwelly. It's just because it's small, right? It's small. The letters are small on the, and it's round like that. It's like, it's not straight on. Where is the? You said there is an amazing plastic surgeon somewhere. Is it? All right. Okay. Right. Look. TikTok and Facebook and YouTube and all. You should see that. That was on Instagram. Thank you for that, Iwelly. Very, very grateful for those words of support. It's a friend of mine was singing your praises. Okay, that's good. Thank you. Must be doing something right. That's nice to hear. Thank you very much. It's good to hear that someone's happy. Do we offer bilateral grommet insertion? I think I know why this question's come up. The answer is no. And the questions come up is because we're doing AdWords. I don't know if you know what AdWords are. Google AdWords, where you pay for sort of advertising things. And we're doing AdWords, and we're doing adverts for otoplasty, which is prominent ear correction. And I manage it with Johnny. We have a look at it. We have a look at all the figures every week. And I think we've been getting an awful lot of people who are searching for grommets, who are searching for ENT surgeons, who are searching for tympanic surgery, and all this kind of inner ear surgery, which is completely inappropriate. So this is probably a person whose Google has said that, you know, has put our ad in front of them when they're looking for grommet insertion, but it's not. We don't do any kind of inner ear stuff. So grommets are in the eardrum. It's a little plastic tube they put in the eardrum to release the pressure if you've got kind of glue ear, if you've got build up a fluid the other side of the eardrum. So that's an ENT surgeon that does that. So we are plastic surgeons, and we will just reshape the external ear, We don't work on the inner ear, so we don't do any sort of thing to the tympanic membrane, the eardrum, and we don't do anything like grommets. So is it best to have liposuction revision for dog ears or 2 small incisions on the size of my hips? How long is the recovery for each procedure? What's the best aftercare for each procedure? The incision is, oh, crikey, what's this? The incision is healing well since my op in September 2024, and I would prefer not to extend the cut. I had a wall muscle reconstruction last September and tummy tuck with biomesh repair to remove the previous synthetic mesh that shrunk and wrapped itself around my umbilical cord. What? And I also had a hole in one of my abdominal muscles, which was causing me to have a lot of pain for the past 8 years. Previous surgery was back in 2016. The biomeshes are running vertically from top of my abdomen down and horizontally from hip to hip. Crikey. Well, this is not my patient, for sure, because I would remember doing that operation. Crikey, O'Reilly. Okay, so what's the best after? Right, well, if you've got, so that's background, very good background, thank you for that. So you've obviously had an extensive tummy tuck with mesh, and you've got dog ears. The answer to that is plain and simply talk to your surgeon about the pros and cons of doing liposuction or excision, because I don't really want to say you should have one or the other, and then the surgeon who knows you and who knows your abdomen and knows what they've done, and then says you should have the other one, because who am I to say? Your surgeon knows you, knows what the dog ears are like. I don't know what your dog ears are like, so always best to talk to your surgeon about that. Yeah, it kind of depends whether the dog ears kind of got a lot of fat in it, in which case some liposuction might help to sort of empty it out. Often dog ears kind of like a pleat of the skin, so the sort of standard treatment for dog ears is to excise them. Dog ears are little bumps at the end of the scar. You often get them with tummy tucks, and standard practice I would say is to excise them, but not unreasonable to suggest liposuction if there's a bit of fat left behind there, and you've sounds like you've had a bit of liposuction at the procedure. Maybe there was a bit left. I don't know is what the best one is. Talk to your surgeon. Depends on your depends on the surgeon's preference, and also how much fat is in them, and whether it's an excess of skin. As I say, often dog ears are an excess of skin, which is why the excision's required. But obviously that does extend the cut, so some people would prefer not to have that. So 6 and 2, well, it's not quite 6 and 2/3. It's just different. Depends on the dog ear that you got. Excuse me. Can I drive after having a lipoma removed? Well, it's funny you should ask that, because Vicky, the clinic nurse, has actually read the little booklet that you get with a local anesthetic, and apparently it says you shouldn't drive after an anesthetic. So apparently you shouldn't. Now, I've got to be honest with you, I've been doing anesthetics, I would say all my life, but obviously not when I was a child, but for a long time. And I didn't know that, and I've been doing anesthetics in the NHS, local anesthetic cases, and I don't, people drive there and people drive home. You have a local anesthetic when you go to the dentist. No one's ever told me not to drive home. So people do drive after a local anesthetic, but if you ask specifically the question, I think there's something in the small print somewhere that says you shouldn't drive after a local anesthetic, but yeah, I mean, often people do drive after having things like lipomas removed and moles and cysts and what have you, which is obviously up to them, but apparently it does say that you're not supposed to after a local, but I think it is widespread practice, I've got to be honest with you, of people driving. And as long as you feel fine. I mean, obviously, if you've got someone to take you, it's better if you have, but not everyone has. And if it's kind of like a relatively minor thing that you might feel, well, you might want to sit down, have a cup of tea afterwards. You're welcome to do that, sit in the waiting room for a bit. But yeah, it is usually reasonable if people do want to drive, but, especially if you've had local anesthetic before and things like that. How small can you go with the breast reduction surgery? Yeah, this is someone I asked a question on some platform, didn't they, Anna? Because they said they their breasts look like a set of breasts that I posted somewhere, the post-op of a breast reduction. That's how they look now, and they wanted a breast reduction, if that makes sense. And that's not unusual for someone with very big breasts. Post breast reduction, the breasts can still look quite large, and you could look at them and think, what the heck, they've had a breast reduction, crikey, not a very good breast reduction, they're still quite large. But when you look at the pre-op, you all of a sudden think, crikey O'Reilly, they have had a breast reduction, you know. So the thing about a breast reduction is you've got to keep enough volume or kind of tissue going to the nipple. So that means that they have got to be a certain size, and that means that if they're like really, really big pre-op, that stalk going to the nipple is going to be long, because when they're very, really big, the nipples are often low. That goes hands in hand. The nipples are low, and so that, you know, you've got a long piece of tissue, kind of, we call it a pedicle, going to that nipple. So then you take all the breast tissue and all the skin around it, and you do the lift, which is an integral part of a breast reduction, and you know, reduce a whole load of volume. But there's volume going to that nipple to keep the blood supply and the nerve supply, because that's a risk with breast reduction. You can interrupt the blood supply, which means the nipple can die. You can lose the nipple when you do a breast reduction, but also the nerve supply, so that you can have altered sensation after a breast reduction. So we try and keep as much blood supply and nerve supply going to the nipple, but that does require it to be a certain size. So the bigger you are before, the bigger you are afterwards. If you're very big, then you can't go very small. So the amount you can go to depends on how big you are, and it's hard to put a figure on it. You can't put a cup size on it, really, or at least I can't really put a cup size on it. But what I say to people, and this might sound a bit vague, I say, look, I can guarantee they'll be lifted, i.e. the shape will be better, and I can guarantee they'll be smaller, significantly smaller. You don't really get anyone saying, oh, I haven't anything done. They're significantly smaller, but I can't guarantee the size they'll be. I can't guarantee, but I'll try my best to make them as small as I can. The problem when you're doing the surgery is you've got this stalk of tissue going to the nipple. If you take too much away, and that nipple starts to go purple, and you start to worry about the blood supply, you know, the artery's pumping blood in, but the veins aren't getting the blood out, so it's going purple. It's hard to go back then. You can't put it back on. So you only know when you've done too much. Sorry, TikTok's frozen up because I've got a low battery. I've got some questions on TikTok. Can I help with skin tags? Is it safe to remove at home? So you are limited as to how far you can go with a breast reduction, but we will do our best to make them as small as we can whilst keeping the blood supply and the nerve supply to the nipple. But it is unfortunately a bit vague. We can't say you're going to be a B cup, or you're going to be a C cup, or you're going to be an A cup, or you're going to be a whatever cup. It is unfortunately a bit vague. But I'll be honest with you, it's vague when you're having implants. Even though I know it's a 250cc implant, I'm a bit vague at how big you're going to be, because it is a bit of a it's not a very precise science, the cup size, the whole cup size game. So you know, it is difficult. So with the implants, we usually give you sizes to get an idea. So can I get help with skin tags? Yes, you can. We can definitely remove your skin tags. Who's this? Ellie? No, not Ellie. Danny. Yes, we can. Is it safe to remove at home? Danny, I've got to be honest, I've got to say no. I'm sorry. People always ask me in YouTube and all sorts, how do you remove this at home? How do you remove that at home? I've got to be honest, it's not great to move at home. Now, skin tags isn't a bad one. People often ask me about moles. And often with a brown mole, pigmented mole, often you've got to get it looked at and potentially send it histology and things like that. So you shouldn't be really messing with them at home. Skin tags, you could make an argument for it with a skin tag, because a skin tag's not going to be a cancer or anything like that. You're not going to want to send it off for histology. They're just a nuisance. But the problem is, it's the sterility. Things aren't clean, and the problem with skin tags is they've often got like a space and a sort of narrow base. And how are you going to do it? You know, people talk about putting cotton around it. I don't know if you've heard of this, and tying the cotton so it all goes black and falls off. But sometimes you need a little stalk. So personally, I often do it with scissors, but you know, do it with sterile technique in the clinic. In the home environment, it's obviously not sterile, so it's not great. So it's not a great thing to do it at home. And have you got sterile scissors? You don't want to use your scissors in the flipping kitchen. You know, they've got to be sharp scissors. You know, when they're sharp scissors, I don't want to be a bad workman blaming them on the tools, but if you don't have sharp scissors, you know, when we do surgery, we will often have single-use scissors. So we use the scissors and then we throw them away, you know, and then we use a fresh pair for the next op. So, you know, at home, and you've got them in the kitchen cupboard, they're not going to be sharp, and you try and cut a skin tag, it's going to like all of that. So I wouldn't particularly. Is it expensive? I have maybe 20. Well, get in touch, Danny, and we can give you a quote for that. If they are skin tags, often send us a photo, because if they're moles and things, we might want to send them histology. But if we're not sending them for histology, and we're just snipping skin tags, we can give you a quote. I did a patient the other day. They weren't skin tags; they were kind of like seborrheic keratoses. They were kind of like lesions, but I did multiple, and we gave a quote for that, because our normal quote is saying is this plus. Is it 700 or something like that? I can't remember what it is. It's several £100. I'll say several £100 plus a few £100 for each lesion. But when you've got 20, that's going to end up going to be a ridiculous amount, and it's not accurate. So we would do a price for you basically when people have got multiple lesions, because it's just like snip, 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 snip. It's obviously not a big. It's often not a big deal for us to do it, so we don't sort of multiply up the price. But you know, it's probably more expensive than having it done at home, to be honest with you. But as I say, not absolutely advisable. What we got? I'm going to open this up because I can't read it on an angle. I'm sure we've got someone say singing. Is it? Hold on a minute. God, I've got questions going on left, right, and centre here. Honestly. Oh, come on, man. I need a PA. I need help with this. Right, let's go back. Where is a friend of mine was singing prayer? Right, we've got that one. That one. That's Davina. I think Chris. Hold on a minute. What the heck? Okay, is it okay to have an implant removed and have a new implant? Oh, it's gone. Is it okay to have an implant removed and have a new implant and uplift at the same time? Yes, it is, Amy Rose. That is not unusual. So your implant, so an exchange of implants and mastopexy, absolutely fine. So you've got implants in, your breasts have maybe settled a bit, particularly if you're downsizing. So if you're downsizing your implants, because your implant would have stretched the skin a bit. So if you're downsizing your implants and your breasts have maybe got a bit of a droop to it, maybe you've had a bit of weight changes, maybe you've had children, so you've got a bit of a droop to your breast. If you're changing implants and not going bigger, and particularly if you're going smaller, then it'd be reasonable to have a lift. Yeah, so completely reasonable, Amy Rose. That is a reasonable thing to do. Any advice you can give on correcting tubular breasts? That is that's a day in itself, Sarah. Tubular breasts or tuberous breast or whatever you want to call it is a very difficult problem to treat, and it covers quite a spectrum. And there's several different things that can make the breast look unusual or not quite how you would like it to look. Often the base of the breast is constricted. Often they're deficient in the lower pole. The nipple down is deficient. Often the nipple areola complex is herniated. It's enlarged. The areola is enlarged and the nipple's herniated, and so it can cover quite a range of things. And you might do different things for those things. So kind of quite a mild tuberous breast deformity, maybe implants might do the trick. You might be able to fill up that lower pole. You might have to do a bit more work. So people with mild tuberous breast deformity, you might be able to just do implants, but you often have to do things like radial scoring of the lower pole to try and release the gland. So the gland sort of expands over the lower pole of the implant, because it can be difficult to get a nice shape in the lower pole. But that's kind of like, I guess, a starting point for a tuberous breast. But sometimes things need to be done to the skin as well, and the areola. So the areola might need to be reduced. A lift might need to be performed to rearrange the tissue to make the shape better. And there's often asymmetries involved. But it's a challenging case, tuberous breast deformity. A lot of people put implants in. A lot of different types of surgeons put implants in, but tuberous breast deformity is probably best for someone who's a sort of specialist in breast surgery. Might be a breast surgeon. I don't know if you know any. Do you know any around? I don't know. I don't know if is there any breast surgeons around? Like, you know how to choose? I don't know. How do you how would you go about choosing a surgeon for your breast? Any ideas how you'd go about it? No, I don't know. Oh, there's a book. There's a book about it here. How to choose a breast surgeon. There you go. Written by, yeah, you got it. Yeah, written by the man. Yeah, okay. This guy wrote the book on it. Okay. Anyway, yeah. So maybe a breast specialist would be good for a tuberous breast, but it's difficult. Tuberous breast is difficult, and managing expectations, as with any of this surgery, is a huge part of it, and particularly in tuberous breast deformity, because it is a tricky one. So yeah, that's a kind of like a idea of what sort of things you often need to do for tuberous breast. So yeah, well, I don't know. I just got back from Tesco's. I don't know what those guys are doing with the shopping, but I left them to it because I had to rush and do this. So I better go and rescue them. I hope to goodness they did the frozen food first. That's all I'm saying, because I did say do the frozen food first. Everyone knows that. But they don't like doing the frozen food for some reason. God knows why. I mean, I all normally do it, but you know, I'll be in touch, Sarah. Okay, Sarah, call me. You know where I am. Okay, so without further ado, I'm going to go and sign off and go and clean up the war zone that is probably the kitchen. Peace be with you, and God rest ye merry gentlemen. Next week is Christmas time, isn't it? I mean, it's Christmas Eve or something. So this guy is going to be, yeah, he's going to be on the sofa, yeah, watching Elf this time next week. So I won't be here, that's for sure. And I suggest you not be here either. So that in that case, it's going to be the week after, probably. Is that going to be New Year's Eve or something, maybe? 17 plus 14, 20, 20, 31. Yeah, it's New Year's Eve, isn't it? So I'm probably not going to be on New Year's Eve because I'm going to be out at some wild party. No, I'm not. I'll be at 10. But anyway, it's just I've got to make myself look like I'm popular. So I probably won't be doing it on New Year's Eve, so that you guys can think that I'm at some party. So probably the week after. January sometime. So I'll see you in the new year, probably, if not before, which from what I've just said probably won't be before. So if you've got any questions, message me. We'll do them in Jan. Have a lovely Christmas, have a lovely holiday, a lovely break, and namaste. Always difficult to know how to end it.